1017 FM and 710 Keel. Robert J. Wright and Aaron McCarty. Guests on Keel are always heard via the Jack Spring Electric Keel Newsmaker hotline. Brian Crawford from Willis Knighton Hospitals. There's lots of those. Hey, Brian, welcome back to Keel. How you been?
Hey, good morning, folks. How are y'all?
The hospital is at capacity. All of your hospitals are at. Is that accurate, Brian?
That's accurate. We're at capacity due to a number of factors, namely COVID, that we thought we had pretty much at least minimized even as early as 6 weeks ago. I had about 8 COVID patients in all 4 of Willis Knighton's critical care facilities in Bossier and Shreveport, and today I sit with plus 85. And when you combine that, as some of the medical experts and other healthcare professionals from Baton Rouge and New Orleans testified yesterday during the governor's press conference, there's a national nursing crisis shortage, which we're feeling the effects of and have felt the effects of through the entire pandemic. It actually started before the pandemic, and so we're extremely short on nurses, just like LSU, Ochsner, and Christus is. And I've got more than 40 of my nurses are out with COVID. And so when you put all those factors together, it's a perfect storm for a shortage.
How did these numbers compare to when we were at the peak last year?
Yeah, when we hit we hit our peak in January. If you remember, the big influx in the third wave came after Christmas and New Year's. We hit 157 COVID, but I had more staff. I had more respiratory therapists. I had more lab technicians. I had more nurses and critical care physicians to take care of those patients at that time. So it didn't impact us as significantly as this current wave is. And so, I know you guys have brought attention to the unvaccinated and the vaccinated, and I'm not going to get into the political debate on that, but I will tell you what the facts are. The facts are more than 90% of the COVID patients that I have, including those that are in my ICU and not surviving, which this time it's different because I'm looking at a younger group. I'm looking at a healthier group. I'm looking at more children, more obstetric, more women, expected mothers that are falling into those groups and categories that are losing their lives that are unvaccinated. That's 90% of what I'm seeing is unvaccinated, and 20% of everybody that walks into an emergency room at Willis Knighton, whether it's in Bossier or Shreveport, for whatever it is COVID related, which is 10% higher than the state average.
Wow. Brian, less than 2 weeks ago, the CDC number said that in Caddo Parish, less than 16% of ICU beds were being used for COVID. So what you're saying is that the increase in numbers is fast, and it's an astronomical rise.
It is, Robert, you're absolutely right. If you looked at it on a graph and a chart, and we've all seen these COVID graphs where we see the needles going up and we see the lines going down. Right now, since June or July, about the first week in July, the needle is going straight up. There's actually no bend, no curve, no flattening that has occurred over the last 30 days. One of the things that we base our strategy on in going forward and staffing and making sure that we have the right number of people, the right supply of medicine on board, and those types of things is having some type of forecast on how long this is going to last. And so we've asked LDH with the state to come up with those models as they did in the kind of the first go-around with COVID last year. And basically they've told us that, hey, there's no way that we can put a time frame on this current fourth wave of this Delta variant because it hasn't even dropped off, even minusculely. It's only gone up every single day, and we've seen that manifest itself in Shreveport and Bossier. So if you can look at a rocket going, that's exactly what we're doing. And so every wave we've had prior to this fourth wave, the first 3 waves, 2 last year, then 1 in January this year, we were able to forecast when that wave was going to plateau, and most of them didn't last more than 2 or 3 weeks before we saw some type of flattening of the curve, and we all remember that term from last year, and actually a deceleration of COVID cases. We can't say that this time. This is forecast to potentially go 3 or 4 months. So until the end of this year, and of course we've got the Delta variant, and of course we've got the Lambda variant is hot on the heels of this new strain, and the Atlanta variant has already showed up in Dallas.
Brian, let me ask you this, and I don't want to put words in your mouth, but we're a week or two away from school going back. You're seeing kids. You have got to be, the medical crews have got to be petrified.
Yeah, I think the doctor from Our Lady of the Lake, and I'm sure you've seen that clip, it's very compelling. The medical director got on there yesterday and said, and she echoes the sentiments of all healthcare workers across the state. We are terrified. The healthcare workers that really thought 2 months ago that we had seen potentially, if not the end of COVID, at least keeping it to a manageable number. They're tired. They're fatigued. They are, they're PSDT candidates because they've been dealing with this for a year and a half now with limited resources that are available. And so, yeah, we're worried because yesterday, and I'll just give you an example. I'm in a meeting about staffing, and I get a text from my ER doctor at Willis Knighton South, who Willis Knighton South has 21 beds to see patients in the ED. He said, Brian, I've got 24 people that are waiting for beds to be admitted in my ED, and a significant number of those were COVID patients, and I'm seeing that in all my ERs. And so if I can stress anything this morning, what was said yesterday in the governor's press conference is, get vaccinated, wear your mask, social distancing, all those things need to be back in place. Help us help you. Don't go to the ER. If you're feeling sick, runny nose, those types of things, go to your primary care physician, go to a quick care. But, if it's urgent, show up at the ED. But the ED is no place to be right now unless you need emergent care because they're packed and there's no rooms available to place our patients.
Brian, what about breakthrough cases and what percentage of your patients are vaccinated? And sort of a part two to that, can you break that down demographically? Is it an upper demo of vaccinated patients?
Yeah, good question. Like I said, with 90% of them being unvaccinated, obviously 10% of those that we're seeing are those so-called breakthrough cases that you're seeing that have been vaccinated. But I can tell you this, experts have told us, not the politicians, it's that if you do have the COVID vaccine, one, you're 25 times more likely not to get COVID, and you're 25 times more likely to have a less severe medical prognosis if you do happen to catch COVID. And that we're seeing that come to fruition with the patients that we do see that are breakthrough, that have had the vaccinations, that unfortunately do end up catching the Delta variant, that their hospital stays are significantly less. The medical acuity, which is their level of sickness, is significantly less, and we turn them out a lot quicker. A lot of those patients, in fact, they come in, they get the remdesivir, the monoclonal antibodies IV treatment, they get it in the ER, or they get it in a scheduled session at our Willis Knighton Bossier campus with their primary care physician referring them there, and they're out the door without any hospital stay.
Brian, Our Lady of the Lake has gotten a federal disaster team. They came in to help. Have you requested that? Will you do that? And are they coming?
That is the thing is, could we use them? Absolutely. I know that team consists of physicians, paramedic, nurses, and a whole group, and we can certainly use it up here. The only challenge with that is that's a very, very limited resource. There's already 40-plus hospitals that have put in for that request, and you're probably only going to see 2 or 3 of those teams deployed in the state. And right now, in speaking with our partners and our sister health systems throughout the state, there is a greater need right now in Baton Rouge and New Orleans and some of those other smaller hospitals. There was the CEO from North Oaks was on there yesterday, which is in Hammond, Louisiana. They have applied for a team as well, and they're smaller. They're about the size of our Willis Knighton South campus, maybe a little bit larger than that. They've got the same number of COVID patients that we do. They've shut down all elective surgeries and procedures that can be put off. And so we're certainly looking at that option, but we haven't made that application today.
Brian Crawford, CEO, head cheese Willis Knighton.
No, not the head, not the head cheese. That's Mr. Elrod.
You're right. You're right.
Congratulations on your unknown promotion, Brian. Aaron's
Right.
Her brain is filled with birthday joy. Today is her birthday. By
yeah,
the way.
whatever.
So.
Yeah.
All right. Well, I heard that she's being promoted to the CEO of Heel, so I'm just
Aaron
congratulating
McCarty,
Aaron for that. So.
CEO of Town Square Media.
Please,
exactly.
But hey, if
thank all the
get your
folks. Please
I
thank
will.
all the folks.
Get your
Brian.
vaccination.
Well, yeah, we're good.
I'm telling you.
Yeah.
I know you are, but the people out there that are spreading so much misinformation, it's really plaguing our healthcare system. And if anybody can do anything, get your vaccinations, keep your distance. Don't come to the ER unless it's absolutely necessary, and help us help you.
Gotcha.
101.7 FM, 710 Keel Sports just ahead. Here's Ruben.